Hello and welcome to the podcast by Bear for Health. I am Dr. Neha Kapoor. I'm a gynecologist working in my own hospital in East Delhi and I'm also visiting at Cloud9 Patparganj. I welcome you all to this podcast. We know the phrase heavy to happy. It sounds like the start of yet another weight loss story. Maybe a new diet, a fitness transformation, or a morning routine that promises to change your life. But this isn't that kind of conversation. Today, we are not talking about body shape or size. We are talking about something that weighs much heavier, yet stays hidden in plain sight. Heavy menstrual bleeding. It's something countless women silently deal with every month, but very few actually talk about it. And let's be clear from the start, heavy menstrual bleeding is anything but normal. Did you know that it affects up to 38% of women of reproductive age and around 30% of gynec visits? Still, most women think it's normal to soak through pads, miss work or school, and feel drained for days. So, today we are busting the biggest myths about heavy periods with the help of our expert guests, Dr. Laxmi Mantri. She's a senior consultant in the Department of Obs and Gynae at BLK Max Super Speciality Hospital, and Dr. Uma Vaidyanathan. She's the director, Obs and Gynae, Fortis Hospital, Shalimar Bagh. Welcome, doctors.
Thank you so much.
Thank you.
Yeah. So, we are going to start with our podcast. For starting, I would like to put up the question what heavy menstrual bleeding really is. Dr. Uma, would you like to take this question?
Yeah. When we talk about heavy menstrual bleeding, it's not just about the duration, it is also about the flow. So, on an average, we say that heavy menstrual bleeding is bleeding that may last for 7 days or more on an average. Or if the patient is soaking more than 1 or 2 pads per hour, needs to change pads very, very frequently. And associated with passage of large size clots, and the bleeding average, on an average, we say the approximate bleeding is around 50 ml in per cycle. But if the patient exceeds and has very heavy flow to the tune of almost 80 ml per cycle, then that counts as heavy menstrual bleeding.
Yeah, that's correct. And also, I feel, ma'am, would you say that it can be different for different people? Like, somebody with a hemoglobin.
It's never going to be one size fits all.
Yeah, exactly.
There are some women that have had a heavy flow right from the beginning. There are some women who may not have a very average sort of description, sort of a cycle. But having said that, any deviation that a patient may note from her routine cycle has to be counted as abnormal menstrual bleeding or heavy menstrual.
So let's see what are the most common causes of heavy menstrual bleeding. Dr. Lakshmi, can you please answer this question?
Sure. There can be many reasons, Dr. Neha, for this. It can be in the form of hormonal imbalances.
Yeah.
This can be because of some thyroid problems like hypothyroid or hyperthyroid or prolactin. Maybe sometimes it is very high. Some uterine anomalies. There can be some fibroids, polyps, adenomyosis. There can be some bleeding disorder which can also run in the families. There may be some family history, like mother is also suffering from heavy menstrual periods and now the daughter is also suffering and they think it is normal. So when the periods are from starting from menarche only, if it is very heavy lasting for so many days, and if there is history like repeated bruising on smallest injury, or there is some history of tooth extraction and patient is having prolonged bleeding, or if there is a very small cut and bleeding, it is a clue for some blood dyscrasias or the bleeding disorder, and one should seek the help. Okay. And sometimes what happens, patient is pregnant, but they are not aware. Sometimes it goes unaware and the patient is having a threatened abortion or some type of abortion and patient is not aware. Patient is bleeding for months together unless they come and we get them investigated. So there are so many problems. If there is some history of drug intake, some medicines they are taking, then also it can be there. So
Yes,
we have
like
to
blood thinners
investigate
have been.
accordingly. Yes.
Yeah. Okay. All right. So now we have laid the foundation that what is heavy menstrual bleeding, what are the common causes. Now let's move on to busting some myths about heavy menstrual bleeding. All right. So I'm going to put up a few myths, and I'm going to ask you one by one to answer them. The commonest myth is that heavy periods are normal periods. Dr. Uma, what is your take on this?
Yes, I guess we have discussed this earlier as well, that there is a pattern that every woman has, right from the time she starts. And I always tell my patients that whenever you notice a sudden change in the pattern that is not consistent with what you've had, suddenly you're soaking more number of pads, suddenly the periods have become very painful, suddenly the duration has increased, suddenly the intramenstrual duration has come down or has increased. All these will account for, an abnormal pattern. Heavy periods, normal periods, if they are heavy, then one has to rule out, as Dr. Lakshmi pointed out, that if there is some bleeding disorder that the patient may have had in the family history needs to be looked into. Because anything that impacts the quality of life and classifies as heavy may not actually be normal. So that needs to be investigated.
Absolutely. Myth number two, only older women or teens, that is extremes of age, get heavy bleeding. Dr. Lakshmi, what is your take on this?
No, I don't think so. Any age of woman can suffer with this heavy menstrual loss. Yes, it is true sometimes in the beginning when the periods start in the teenage group. Yes, they are heavy because the ovulation has not started. Our system, our brain, our glands, this pituitary is not that well developed. This axis is immature still. So there is no ovulation. Egg is not forming and the hormone estrogen is more. So that is why at this extreme age, teenage as well as at the perimenopause, because of the hormonal imbalances, yes, they bleed more because of the deficiency of the progesterone hormone and excess of the estrogen. But any age woman can suffer from this heavy menstrual bleeding. So we have to, rule out all the causes. We can't think that, yes, she's a little girl, doesn't make any difference. Maybe she will be all right in 8 months or 1 year or 2 years and let it go like that. No, we have to investigate.
Dr. Uma, most of the patients, when you talk to them, they feel that, it's better to wait than to take any treatment for this because they feel, this is impure blood and it will get collected inside if you give any treatment. So, what would you like to answer to such patients?
See, in India, most of our women are taught to not talk about their gynecological issues to anyone. So, of course, now with the current generation, the awareness is very much there. But if you see the older generation of women, they still are not very amenable to talking about their gynecological issues. So many a times by the time they actually come to us, the problem has gotten so severe that many a times we have no other option left but to is resort to surgical intervention. So my message would be that the moment you notice a change, please don't wait it out. It is your body giving you a signal. I feel the uterus that way is a very beautiful organ. That if something goes wrong, the first thing it will do is it will bleed. So the easiest way to know that there is something wrong is when there is a pattern change, and that's the earliest when it will actually be treatable, rather than you landing up in a state where treatment options available do not. So no waiting.
Okay, a few women also think that heavy menstrual bleeding only happens after you have given birth. So, Dr. Lakshmi, what do you think about that?
Or it is not like that. It can happen to any age, as I already told. It can be in the teenage group, it can be in the reproductive age group, around the menopause also. So we have to, investigate accordingly and give proper treatment. It can be, hormonal in form of hormonal treatment, in form of a good diet, iron tablets, in form of some hormone intrauterine devices, or if the patient has already completed the family and having many other problems like multiple fibroids or the lining of the uterus, that is endometrium, it is very much thick and not responding to treatment, then maybe sometimes surgical treatment can also be offered to them.
Yes.
There is
And
no age bar actually.
I agree. Dr. Uma, people also think that, you know, it's just part of being a woman, tolerate it. So already you have covered, but I would still like to, address all the common myths.
Uh, See, you have seen it in practice, of course, Dr. Lakshmi and Neha, I guess both of you have seen it in practice that women, by the time they have bled so much and they come to you, they're practically white, pale,
Yeah.
severely anemic. They are unable to, perform their daily routine. If they are working, they are losing out on working days. If they are at home, they are on bed, they are not able to do their daily routine. So, anemia is a very, very big problem that arises in these patients. Apart from, a diminishing quality of life where they are not able to perform their daily routine the way they should. Also, their immunity comes down, obviously, with anemia, with so much of loss of blood. There is going to be a loss in immunity as well, making them susceptible to many other problems. Anemia can lead to cardiac issues also, we know that. So, the earlier it is corrected, the better it is for the patient. So, I feel that it is not that it is not associated with problems, and just by sitting and waiting it out, it will go.
Mhm.
Yes, quality definitely deteriorates. That is true. Patients, teenage babies, girls are not going to the school or they are not going to the work. Mostly they are sitting at home, avoiding social gatherings also because of lack of
They are
stamina,
so restless and
lack of
tired. At the end of
concentration.
it, they're
Yes,
so
they feel
tired.
tired all the time. Yes, yes.
Yeah, so I feel that any amount of bleeding which makes you skip work or which makes you suffer, that is heavy menstrual bleeding for
Right.
that person. Yeah, and
Yes.
it should be treated. And last myth that you should not take treatment because medicines के तो side effect होते हैं. तो ऐसे वाले patients को what is your message?
We have to counsel the patient, explain them in a very nice and polite manner that it is, your health after all. It is not good to sit at home, and treatments are available in form of medication, other small invasive procedures, and a good diet. They will understand ultimately.
Dr. Uma?
Counseling plays a very important.
Yeah, absolutely. What is
So
your message to such patients who don't want to take medicines because of their side effects? They've heard कि hormones से तो body का weight बढ़ जाता है, इस दवाई से तो ये होता है. तो what is your message to such kind of patients?
see, I have seen patients who have taken all sorts of alternative treatments and then come to
Yes,
us right at the end as a last resort. That I guess a lot of it is about reassuring and counseling them that we are there to handle any issues that may arise. Point one. Point two, everything will be very closely monitored. So you need to be in touch with us regularly. I guess regular follow up and monitoring is what needs to be really drilled into the minds of patients, because believe me when I say this, I've had patients who have taken a treatment for abnormal uterine bleeding. If I've written them an oral contraceptive pill, say for 3 months, and I've asked them to revert, they have completely forgotten that they have to come after 3 months and that they've been taking the pills for eternity. Now, that is also not correct. So, whatever you do, please, the message has to go out that whenever you're taking any drug that goes in your system, and if you're taking it for more than 2, 3, 4 months, you have to be in regular touch with your doctor for any potential effects that may arise, and also for a potential tapering of the dose.
Yes,
absolutely.
that is important.
Okay,
Tapering word is, I think, very important. Once you say the patient that yes, we will reduce the
Yeah, it is
hormones,
not a lifelong thing.
it's
Then
not a
they're
like
like, okay, yeah.
yes.
and sometimes patients feel that this is common when you are having menopause, also when you are nearing menopause. So they feel कि ठीक है menopause हो जाएगा तब तक we can bear the heavy menstrual bleeding, but we have to counsel them कि that
Yes.
is okay, that
Sometimes
is normal, but then
That
you
is the
can't
main time
jeopardize
when
the
you
health.
land up with hysterectomies for
Exactly.
heavy bleeding. And
Yeah.
many a times these are treatable just by starting them on very basic, simple treatment.
Okay, I think we can move on to our next segment, from myths to management. Dr. Uma, can women what can actually do if they are dealing with heavy menstrual bleeding? Like, What are some tips, real life tips, treatment options, or investigations that you would advise as a baseline to them?
See, I guess visiting a gynecologist it tops the list first.
Yes,
They
absolutely.
need to first visit a doctor and understand what exactly is wrong with them. How will they understand what is wrong with them if they have tracked their cycles? Now, most of us own a smartphone, and all smartphones that you can think of have period tracking apps in them. So, make use of technology in a positive manner, not just scrolling on Instagram, but also to track your cycles. And most of these apps, they give you a signal, they send messages to you saying that there is an abnormality in the cycle that is noted. So they are very, that way, quite good and very comfortable and very easy to use. Whether it is Android or it is an iPhone, you have apps across all segments. So you can just download that app, enter your data, put in your symptoms, and it will automatically tell you over 3 to 6 months what your pattern has been. Has there been any significant deviation? And once you know that there has been a deviation, just go and meet your doctor. Secondly, diet. Very important. Avoid junk food, avoid food delivery apps as much as possible. Eat good, home cooked, healthy food rich in iron. Eat green leafy vegetables, eat fruits, increase the fiber content of your diet. Most importantly, regular exercise, very important. Physical activity is very important. And last but not the least, don't fear treatment. The earlier you sort of, diagnose your condition, your gynecologist diagnoses your condition. All of us are sitting here not to do your hysterectomies or to remove your uterus. Very important. We are not interested. We do want you to retain your uteruses for as much long time as possible. So please, the message that needs to go is we are not interested in hysterectomies. We are interested in conserving as much as possible, and even in conservative, there are many modalities. Like as you said, tranexamic acid is one. There are hormones. There are intrauterine devices that are available. Injectables are available. So many non-surgical options are available before we actually think of surgical options for treatment. So take advantage of the fact that technology is on your side and read about it and talk to your doctor.
Dr. Lakshmi, would you like to add anything to this?
That's all. I think early referral should be there, and patient should seek the doctor's advice earliest.
So I believe that the most important message is that talk openly about your period.
Yes,
Don't
Yes,
let embarrassment or shame prevent you from visiting a doctor.
true.
absolutely.
Or even
Absolutely.
procrastination. Sometimes it's not about embarrassment or anything, it's just about that you are not taking your health so seriously. As women, we always tend to forget, procrastinate everything when it comes to us.
Yeah, we tend to think that सबका देख लेंगे अपना बाद में करेंगे बट
Exactly.
अपना बाद में करने के चक्कर में आप ये भूल जाते हैं that you are the
Pillar of the house.
main
Yes.
person that controls everything. The
Yeah.
neck of the family is the woman. Neck goes off, nothing works. So you have to be, and you have to understand the fact that it is on your basis that on your good health that your immediate family also functions normally. We've seen it in our own home. When our mothers were not well, the whole house would completely collapse. We've seen
Yes.
that as children.
Yeah.
So I guess it's the same with you also that prioritize your health first.
Prioritize.
Rest will automatically.
So I think that brings us to the end of this podcast. So, to all our listeners, if your period is affecting your energy, your confidence, or your ability to show up fully in your life, it's time to listen to your body because your period shouldn't make you suffer. And thank you, Dr. Lakshmi and Dr. Uma, for busting the myths and breaking taboos today. If you found this episode helpful, please share it with your friends, your sisters, and daughters. Let's challenge the stigma. Let's change the story. Because when it comes to our health, we deserve nothing less but the truth. Period may be natural, but suffering is anything but normal. Until next time, stay informed, stay empowered, and take care of your health. For more such videos and information, do subscribe to Bear for Health Facebook, Instagram, and YouTube channel. Thank you.
Thank you so
Thank
much. Thank you.
Okay.